Hi, this is Paul Barr, news editor with Hospitals and Health Networks magazine. I'm here today with Marc Harrison, President and CEO of Intermountain Healthcare, and he's also a physician. Thanks for being with us today.
Thanks. Really glad to be here.
One of the things I was hoping to talk to you about is the question of innovation. Hospitals know they need to do it, but what are some of the challenges they're facing in that regard?
I think you really have to frame up exactly what kind of innovation we're talking about. A lot of the innovation at Intermountain comes from just the way we do our day-to-day work. So whether it's developing cost transparency or an improved supply chain or a new clinical program, what we're trying really hard to do is make sure that our innovation activity is really tied very closely to our mission, vision, and values.
Do you have a formal innovation team?
We do.
Affordability is a big issue right now. Can you describe how you're tackling it?
Great. Thank you for asking that question. This is something that's near and dear to our heart. The way we look at affordability is by controlling costs and keeping our charges under control. This is money that doesn't come out of our customers, our patients' pockets, and doesn't come out of our communities, doesn't come from the government. Happily, Intermountain's had decades now of work on affordability. It's always been part of our ethos to identify things that don't need to be done, and we stop doing them. Increasingly, we use tools like a transparency tool that we called ProComp, which is now morphed into one of our new companies called Empiric Health. And that technology provides clinicians with on-the-spot transparency about what the instruments and drugs and devices they use cost. And we've been able to actually embed that in just the way we do business. In fact, over the last couple of years, we've saved about $100 million across half of our system using this tool.
And that's something you developed in-house, and now it's commercially available? Is that
It's
correct?
becoming commercially available. Loma Linda just signed on as our anchor client, and over the next 12 months, we expect to really get rolling.
Given all the uncertainty that's around in healthcare, how can hospital managers do what they do?
This is a great point. So there is enormous uncertainty, and I think it can be paralyzing if you think about all the things that you can't control. So what we do and what I do is I think about what can I control and what can I lead explicitly and get our team to really get their teeth into. And that really relates to how do we keep quality as high as possible? That's completely within our control. And how do we mitigate cost to make sure that we use the right number of resources based on whatever the problem the patient has. So as the rest of the world changes, and I can't control that, we make plans, but the things we really focus on are keeping quality high and keeping costs low.
Can you give some examples of ways that you're able to cut costs?
Sure. We try and keep care affordable by delivering the right care in the right place at the right time for the right cost. So a couple examples of this are our Telehealth initiative, where people can get primary or secondary care visits on their phone or on their laptop. What we do is we've priced things in such a way that it incentivizes people to use the least restrictive mechanism to receive their care. So a telehealth visit is a little less expensive than an office visit, which is less expensive than an urgent care visit, which is dramatically less expensive than an emergency department visit. And we see patients self-triaging to the right level of care. And so this is actually a really nice way of keeping costs down.
And patients are participating in this?
Yes, they are. And more month by month. We're really excited that as we complete the rollout of our electronic medical record across the system in November, telehealth visits are going to be hardwired into the way the templates and the EMR is set up so that each individual doctor will be able to, she or he will be able to have telehealth visits with their own patients at their convenience.
And in terms of affordability, how big of a role does the physician play in that?
Almost everything we do is either physician-led or physician co-led, particularly items around things like around physician preference items, formulary choice, some of the work we do around making sure that at point of care, cost is controlled. That really is physician-driven.
Thank you for speaking with us today.
Oh, it's my pleasure. That's been great.
This is Paul Barr with Hospitals and Health Networks.